With the current measures in place and Guyana's proximity to Brazil, which it shares a border with, the chances of the P1 variant not being in Guyana are slim to none. Although government took the decision to restrict air and land travel with that country. The fact remains that the borders are porous and entry is still possible through the numerous unofficial ports. Interestingly, health authorities in Trinidad and Tobago have been able to confirm the presence of the P1 variant in 15 patient samples, and the country has since intensified its lockdown measures. However, in the case of Guyana, health authorities are uncertain about the presence of the variant in the country. Instead, the massive rise in cases and fatalities is being treated as a third wave, and the solution seems to be a mad dash to inoculate all and sundry. In an interview with Nightly News on Thursday, head of medical services and cardiology at the Georgetown Public Hospital Corporation, Dr. Mahindra Carpen, was asked about what he suspects is behind the unprecedented consistent increase in new infections and deaths. He noted that while there is a strong likelihood that the Brazilian variant also exists in Guyana, there is lack of hard evidence. As such, there is no need at this time to restrict travel from other countries.
I'm not sure that that is the best option, because we see, even in places that have done that, in our neighbors in Trinidad, there is still a surge in cases. So I'm not sure that we have adequate and sufficient evidence to pursue that approach. Almost an impossible task, given our resources, to shut us off from the areas of known traffic.
Just a few weeks ago, via a release, the Health Ministry divulged that Guyana has been hit with a strain of the virus that is stronger, deadlier, more transmissible, and so severe that it attacks healthy young adults with no pre-existing conditions and no comorbidities. This prompted health authorities to issue a stern warning to citizens for strict adherence to the guidelines. Since the country does not have the medical capacity to test for new COVID-19 variants, arrangements were set up with the Caribbean Public Health Agency in Trinidad and Icahn School of Medicine in New York for patient samples to be sent for testing. A total of 10 patient samples were sent to Carpen in January, and the results, according to the health minister, proved that there were no other existing variations of the virus at that time. Minister of Health Dr. Frank Anthony indicated during the daily COVID-19 update on Friday that while the country has samples ready to send to Carpen, it is exploring other facilities that can conduct the very critical genome sequencing.
Carpen is one possibility. And other facilities, we are looking at that as well. The thing is that with the other facilities, you probably have to, you'll have to pay. With Carpen, we have an arrangement where these things can be done more or less free of cost. But again, it comes back to capacity, it comes back to being able to select well, not select samples, but to get the laboratory to do the sequencing. And
Guyana witnessed a total of 65 persons dying from COVID-19 in April, which is considered the deadliest month since the index case was identified on March 11, 2020. The death toll for the first 7 days in May is 14. Temika Rodney reporting for the HGP Nightly News.